From the research, what we're learning so far is that there are at least three main potential causes of long COVID brain fog. The first is inflammation. So essentially, this is when the viral infection prompts an inflammatory process throughout the body. And in this case, it's in the brain. And what happens with neuroinflammation or inflammation of the brain, there's a decrease in the signaling, which can cause some of that inattention, difficulties with memory, and some of those other thinking problems. A second mechanism that we're learning about is how it affects our vascular or our veins and arteries and capillaries in our brain. So the blood supply, really. COVID-19 can contribute to vascular inflammation. So kind of leading into the whole inflammation idea, but more at this vascular level. And in this case, it affects the blood flow to the brain. And then lastly, the third mechanism that we're studying is our autoimmune response. So this is when our body is fighting off infection. And unfortunately, what happens is with an autoimmune response is it's a faulty immune activation triggered by the presence of some antibodies. And so essentially our brains might be trying to clear out this infection, but it's kind of attacking itself and causing a little bit of damage in the process.